Assalamualaikum warahmatullahi wabarakatuh. Hello guys, I'm Nurisa binti Roslan, is the leader of this group. Our group will explain about a disease which is pulmonary oedema. Without wasting time, I will leave it to my groups to explain their respective part. Let's go.
Assalamualaikum and hi, my name is Christina Patricia. My number matrix is DNS 07212200 and I'll be presenting the definition of pulmonary edema along with the anatomy of normal lungs versus pulmonary edema lungs. I also will present a half part of one of the actual nursing care plan. So without wasting any time, let's get started. The definition of pulmonary edema. Pulmonary edema in general can be defined as an abnormal accumulation of fluid in the lung parenchyma. It could lead to diminished gas exchange between the air in the alveoli and pulmonary capillaries that cause respiratory failure, which means it could lead to shortness of breath. It also causing the swelling of the lungs. Next is the anatomy of the normal lungs. So, this image demonstrates pulmonary edema. You can obviously see the difference between the normal lungs and the lungs that are related to an injury like pulmonary edema. But before we jump into the explanation of pulmonary edema lungs, let's see the anatomy of normal lungs. So, lungs are the major organ in the respiratory system. Lungs are divided into few lobes, which the right lungs has 3 lobes and slightly larger than the left lungs, which it has only 2 lobes. The lungs are separated by mediastinum. The area contains the heart, trachea, esophagus and many lymph nodes. As you can see, the lungs are covered by pleura and separated from the abdominal cavity by the diaphragm, and normal lungs has clear alveoli and no fluid buildup in the lung. Heart and lungs work together to make the gas exchange happen because the heart drains all the use of blood that the body has used. Next, I will present the pulmonary edema lungs. Pulmonary edema occurs when the alveoli fill up the lungs with excess fluid seeped out of the blood vessels instead of air. You can see from the image above, the lungs become swollen and larger than normal lungs. The fluid that fills in the alveoli make people who suffer pulmonary edema unable to breathe properly. The fluid in the alveoli leak into the lungs.
My name is Norishka Izzati and my matrix number is DNS 07212204. So I will explain about etiology of pulmonary edema. There are several possible causes of pulmonary edema, and one of the most common causes of pulmonary edema is congestive heart failure, CHF. Heart failure happens when the heart can no longer pump blood properly throughout the body. When this happens, it will create backup of the pressure in the small blood vessel of the lung, which cause the vessel to leak fluid. Other less common medical conditions that can cause pulmonary edema include heart failure or other heart disease, leaking narrow or damaged heart valves, sudden high blood pressure, and pneumonia. External factors. Some external factors can also put extra pressure on the hearts and lungs and can cause pulmonary edema. These outside factors are high altitude exposure, lung damage caused by inhalation of toxin, severe trauma, and kidney failure. Pathophysiology. Pulmonary edema is caused by congestive heart failure. This happens because of the heart is not able to pump the blood efficiently throughout the body. Blood can back up into the veins that take blood through the lungs. As the pressure in this blood vessel increases, fluid is pushed into the air space, alveoli, in the lungs. In a healthy body, the lungs will take oxygen from the air you breathe and put into the bloodstream. But when fluid fills your lung, they cannot put oxygen into the bloodstream. This deprives the rest of the body of oxygen.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nurisa binti Roslan. My number index DNS 07212214. I will explain my parts, which is clinical manifestation. The clinical manifestation of pulmonary oedema are divided into 2 parts, which are acute and chronic. Firstly, I will explain about signs or symptoms of acute pulmonary oedema. First, that we can see difficulty breathing or extreme shortness of breath that worsen with activity or when you lying down. Second is a feeling of suffocating or drowning that worsen when you lying down too. Third, a cough that produce frothy sputum that may be tingled with blood. Fourth, wheezing or gasping for breath. 5. Cold and clammy skin. 6. Anxiety, restlessness, or a sense of apprehension. 7. Second last is DIGNOSIS, and the last one is palpitation. Next, I will explain about chronics of pulmonary edema. First, difficult breathing with activity or when you lie flat. Second is awakening at night with a cough or restless feeling. They may be relieved by sitting up. Third, more shortness of breath than normal when physically active. 4. Wheezing. 5. Rapid weight gains. 6. Swelling in the lower extremities. 7 is fatigue. 8. New or worsening cough. That's it. Next, I will explain investigations of pulmonary edema. First is chest X-ray and second chest CT. For your information, these two medical devices are used for confirm the diagnosis and to show fluid in interstitial space. Third is pulse oximetry. This is used for determining how much oxygen in blood. Fourth, arterial blood gas test. This is to know amount of oxygen and carbon dioxide. Number 5 is B-type natriuretic peptide (BNP) blood test. This is for increased level of BNP signal of heart conditions. 6 is other blood tests. This is for complete blood counts, kidney functions, and thyroid function tests. 7 electrocardiogram, echocardiogram, second-class cardiac catheterization, and coronary angiogram. And the last one is ultrasound of the lung. Next, I will pass to my friends to elaborate more about pulmonary edema.
Hi and Assalamualaikum everyone. My name is Radino Hazira, matrix number DNS 07122229. So today I'm going to explain that what is the medical treatment for pulmonary edema. The goals of acute pulmonary edema management are to decrease the amount of the work the heart has to do, also are attempt to decrease the amount of fluid that the heart has to pump. It is also support in improving oxygenation, perfusion, and hemodynamic. To prevent serious complications such as vital cardia or renal damage, prompt treatment is very essential. The treatment of pulmonary edema largely depends on its cause, and the first treatment for acute pulmonary edema is supplemental oxygen. This is initial treatment for patients who are at hyporexic, as oxygenation is priority. Doctor will monitor if your oxygen level is too low or patient is having trouble in breathing. Emission of supplemental oxygen is depending on the degree of hyporexia, and oxygen may be administered by either a low flow such as bronch or high flow system such as a face mask. It is to increase oxygen level in a patient's body. Depending on the severity of patient's condition and the reason that caused the pulmonary edema, it may also receive one or more of the following medications, such as diuretic, morphine, and nitroglycerin. Most cases of cardiac pulmonary edema are treated by using diuretics. Diuretic is indicated for patients with evidence of fluid overload. Diuretics such as furosemide, Lexis, is decreased pressure caused by excess fluid in the heart or lungs. This may be repeated based on a response of clinical symptoms. Diuretic effectiveness is greatly reduced in the presence of hypotension and when patients have been taking oral diuretic for a long time. The second medication that commonly used is morphine. It is to relieve patient difficulty in breathing and anxiety. It administered through an IV or by mouth. The use of morphine is not convergent and should not be given to patients with acute decompensated heart failure. And lastly, vasodilator such as nitroglycerin. It has proven to be highly beneficial when used in patients with a pulmonary edema as it delays the coronary vessels and allowing for a greater myocardial blood oxygenation. Other than that, it is to ensure the blood pressure is maintained above 19 per minute. So, the primary role of the health education is to facilitate the learning process and help community to make informed decisions about health or disease issues, especially for those who with a higher risk for developing an illness. Start with a healthy, well-balanced diet and maintaining a healthy body weight. It can help reduce the risk of future episodes of pulmonary edema. So, the healthy diet that is recommended is low-sodium diet basic. Getting too much sodium in your diet, it can cause your body to retain fluid. So, limit your intake to not more than 2000 mg a day and it can help control the accumulation of lung fluid. So, the first thing that you can do is to limit sodium intake is to stop adding salt into your food. So the example of low sodium food is you can easily limit your daily sodium intake by eating more fresh food and fewer packaged foods. Include fruits, vegetables, meat and fish, well prepared without high sodium. It may decrease your symptoms and help to boost more energy. Number 2 is encourage adequate fluid intake, 2 or 3 liters, and if oral intake cannot be maintained, IV administration of fluids and erythrocyte may be necessary for the acutely ill patients. Number 3 is smoking. There is always a healthy idea to stop smoking and it is never too late to quit. It can make your condition and symptoms become worse. And rest. Return to activity slowly or start with an lightly exercise, otherwise it can be lead to difficulty in breathing. Good lightly exercise to start with is walking. Try to stay as active as possible. So, get enough rest at night, even though you may have trouble breathing when you are lying down, elevate the height of your bed and it may help you breathe easily while resting or sleeping. And don't forget to continue breathing exercise to clear lung and promote full expansion. And lastly, follow up. The underlying cause of the patient's acute pulmonary edema should be treated. This includes reviewing their medication to see if any drugs could have contributed to the problem. A procedure such as X-ray usually done to ensure lungs are clear.
Assalamualaikum and hi, my name is Nur Shafinas Izzati, DNS 07212219. So today I'm going to speak out about the surgical treatment in pulmonary edema. I have found a surgical procedure which is thoracentesis. Thoracentesis is a procedure to take away fluid or air from around the lungs. Thoracentesis is not a major surgery when it usually considered as a barely invasive surgery. It does not require any major surgical cut or incisions. As we know from the beginning, pulmonary edema defined as a condition that caused by excess fluid in the lungs. When this happens, thoracentesis may be needed to remove the excessive fluid from the lungs. What are the steps in this procedure? Let's move on to the indication for thoracentesis first. There are two groups of indication for thoracentesis, which are diagnostic and therapeutic. Diagnostic thoracentesis indicated for almost all patients who have pleural fluid, and therapeutic thoracentesis concerned to relieve symptoms in patients with dyspnea caused by a large pleural effusion. Next will be contraindication. There's 9 of absolute contraindications. Several will be under relative contraindications, which are bleeding disorder or anticoagulation, uncertain fluid location, minimal fluid volume, altered chest wall anatomy, cellulitis or herpes zoster at the site of thoracentesis puncture. Another two are pulmonary disease and uncontrolled coughing or an uncooperative patient. As we all know, every procedure may have complications. Same to this, thoracentesis also have some complications. The major complications include pneumothorax, which is we understand it as a collapsed lung. Second, bleeding or hemolysis due to lung puncture. Third, re-expansion on pulmonary edema or hypertension. Next, hemothorax due to damage to intercostal vessels. The two last complications are puncture of the spleen or liver and vasovagal syncope. Before we jump into the steps in this procedure, we must know how to position the patient when we perform this procedure towards patient. This procedure is best done with the patient sitting upright and leaning slightly forward with arms support. Let's move to the steps in this procedure. It will be divided to 3 parts, which are before, during, and after thoracentesis. So I will start with the steps before the procedure. First, the doctor may perform chest ultrasound to identify the area with the greatest amount of fluids. Then the doctor will insert the needle into this space. Before carrying out the procedure, the doctor will sterile the injection site and administer local anesthetic. During the procedure, patient usually remain awake. The doctor may ask the patient to position themselves sitting on the edge of a chair or bed with their head and arms resting on a table. Next, the doctor may ask the patient to hold their breath during the procedure. Some patients report the urge to cough as the fluid drains out and their lung re-expansion. It is important to stay as still as possible throughout the procedure to avoid any accidental damage to the lungs. Then, the doctor will attach a tube to the needle to aid drainage if there is a lot of fluid to remove from pleural space. At the end of the procedure, needle will be removed
and the area of injection will be covered with a dressing. While after the procedure, the patient will receive an X-ray to check that the procedure was a success. The doctor will send fluid sample to a lab to help identify the causes of the pleural effusion. The results will help the doctor make an accurate diagnosis and provide appropriate treatment. A thoracentesis is a relatively simple procedure that involves using a needle to remove fluid from the pleural space.
So the first actual nursing care plan will start from me. I will be presenting the assessment, diagnosis, the goals, and the first two interventions. I'm going to start off with the assessment. Assessments are divided into two datas, which is subjective data and objective data. For the subjective data, the patient complained a feeling of being tired and weak when doing some activities. While the objective data, we have observed the vital signs. For the blood pressure, it was 140/90. The respiratory rate was only 32 per minute, which was low, and the pain scale is 8 out of 10. Next is the diagnosis. The nursing diagnosis is activity intolerance related to imbalanced oxygen supply and demand. For goals, after an hour of nursing interventions, the patient will finally decrease the pain scale from 8 out of 10 to 4 out of 10. The patient also will be able to demonstrate decreased level in the physiological signs of intolerance. Now I'm going to present the first two interventions. The first intervention is monitor the vital signs such as blood pressure, pulse rate, and respiratory rate. The rationale is to track changes in patient's condition. Second intervention is assess the patient's pain by using the numeric scale. The rationale is to be aware of the patient's level of pain that the patient felt as it was stated the base scale was 8 out of 10.
Number 3. Assess patient ability to perform normal tasks. Rationale to note any health illness such as weakness, fatigue, and difficulty in accomplishing tasks. Number 4. Position patient in a semi-fowler and encourage deep breathing exercise. Rationale enhance lung expansion to maximize oxygenation for cellular uptake. Number 5. Provide supplemental oxygen as doctor order. Rationale to reach the target SpO2 at least 95%. Number 6. Provide quiet, comfortable environment and limit visitor as necessary. Rationale to avoid emotional and mental stress on patient. Number 6. Provide emotional and psychological support. Rationale to avoid stress and depression and may decrease the effect of illness on patient. Evaluation. After an hour of nursing intervention, pain scale decreased to 4/10. Number 2. Patient able to demonstrate a decrease in physiological signs of intolerance.
So next, we can discuss some nursing care plans for a pulmonary edema. Nursing diagnosis that related to potential problem is would be assess fluid volume related to increased preload and decreased cardiac output. As evidenced by subjective data, patient complains of shortness of breath, while objective data is proved by a decreased body weight, clammy and pale skin. Blood pressure is proved by 160/90 and pulse rate is 120 per minute, while respiratory rate is 28 per minute. Patient pain was also be assessed with using pain assessment tools such as numerical rating scale and visual analog scale. Pain score that is documented are which higher, which is 8 per 10.
Next, I'll be explain for goals. After an hour of nursing intervention, the patient will firstly decrease the pain scale until 4/10. After that, the goal is the patient can stabilize the fluid volume.
The intervention number 1 would be monitor the patient's vital sign such as pulse rate, blood pressure, and also respiratory rate, especially the oxygen saturation and characteristic of respiration at least every 4 hours. For the rationale is to track change in patient's conditions and also to check if there are any sign of hyperexemia and respiratory ascidosis. Other than that, it is also to monitor the effectiveness in the medical treatment. Intervention number 2 is to assess patient pain using pain assessment tools such as numeric scale. The rationale is to assess level of patient's pain and also to be aware of patient's level of pain that the patient felt as stated by pain score of 8 per 10. And the intervention number 3 is to monitor the patient's respiratory activity such as lung sound. The rationale for that intervention is to provide early warning sign of hyporexemia. Also, if there's any low pitch wheezing sounds, it can be sign to thickening in bronchial tubes and lead to chronic obstructive pulmonary disease.
The next intervention is monitor all the fluid intake. The rationale is to reduce total body water and prevent fluid reaccumulation. This intervention can prevent excessive fluid. Intervention number 5 will be monitor patient's weight daily at the same time each day. The rationale is to compare weight of the patient to the previous measurement because body weight is a sensitive indicator of fluid balance. Next, administer 40 mg furosemide or its other name called Lasix 3 times a day by slow intravenous as doctor ordered. The rationale is to decrease the pressure caused by excess fluid in heart and lungs. The last intervention is provide psychological support and divisional therapy. The rationale is to provide comfort and divert mind of the patient from the pain. Now let's move on to the last part, which is evaluation. After an hour of nursing intervention, the pain scale finally decreased to 4/10. Here we can see that the patient pain totally decreased from 8/10 to 4/10, and the patient finally can stabilize the fluid volume.
Actual nursing diagnosis for pulmonary edema, assessment subjective data, patient complaint of difficulty breathing, objective data, blood pressure 135/84, respiratory rate 32 per minute, heart rate 120 bpm, oxygen 85%. Nursing diagnosis, infective airway clearance related to accumulation of mucus and consolidation of lung tissue. Next.
Okay. Goal outcomes. After an hour of nursing intervention, the patient will reach at least 95% oxygen. The patient will maintain a clear airway. Intervention and rationale. 1. Monitor vital sign BP, HR, and NRR and assess breath sound via auscultation. Rationale to track change in patient condition. 2. Assist the patient to an optimal upright position. The rationale is sitting upright provide for an ideal body element for maximum lung expansion. Respiratory muscles such as the diaphragm have enough space to expand and contract. 3. Administer supplemental oxygen as ordered. Rationale to reach the target SpO2 at least 95%.
Next intervention is encourage the client to cough and deep breathe. Rationale: induced coughing and deep breathing help improve clearing excretions and increase oxygenation. This exercise will help your breathing, clear your lung, and allow the body to take more oxygen. 5. Administer the prescribed morphine sulfate MS contain 50 mg as doctor ordered. Rationale to relieve shortness of breath and anxiety. 6. Provide quiet, comfortable environment and limit visitors as necessary. Rationale to avoid emotional and mental stress on patient. If patients are comfortable, they are likely to recover quicker and have better health outcome. Evaluation: after 1 hour's nursing intervention, patients are able to maintain clear airways and the patient reaches 95% oxygen.
Potential nursing diagnosis for pulmonary edema. Assessment subjective data, patient complains of chest pain and difficulty in breathing. Objective data, blood pressure 130/100, heart rate 120 bpm, pain scale 8/10, respiratory rate 32 per minute, oxygen 85%, patient skin cold and pale. Nursing diagnosis, decreased cardiac output related to myocardial contractility. Next.
Goal outcomes. After an hour of nursing intervention, the patient will decrease pain scale 2/10, reduce patient chest pain, able to breathe easily. Intervention and rationale. Monitor number 1, Monitor vital signs such as HR, BP, and RR. The rationale is to track change in patient condition. Number 2, examine the patient pain using the numeric scale. The rationale, to be aware of the patient level of pain that the patient felt as stated by pain score of 8/10. Number 3, place the patient in a semi-fowler position. The rationale is to keep the airway clear and open.
Next intervention is administer supplemental oxygen as ordered. Rationale to reach the target SpO2 at least 96%. Supplemental oxygen can reduce shortness of breath, increase oxygen in your blood, and ease the amount of work your heart and lungs have to do. 5. Administer sublingual nitroglycerin nitrostat 0.4 mg every 5 minutes as doctor ordered. Rationale to lower the pressure in the heart. This increases the amount of blood and oxygen that reach your heart. This also reduces chest pain. 6. Educate patient on home healthcare. Rationale assist patient in understanding measures they can take at home to improve their cardiac health and prevent further deterioration. Evaluation. After an hour of nursing interventions, patient will be chest pain reduced, pain scale decreased 2/10, and patient could breathe easily.
Assalamualaikum and hi, my name is Atika Sofia binti Asmira. My metric number is DNS 07212202. I would like to present about rehabilitation treatment in pulmonary edema. Number 1 is physio. Physiotherapy is measured to reduce the pain problem faced by patient. There are several physiologies for pulmonary edema. I use CPAP, intensive spirometry, and monitor blood pressure. CPAP can allow air to carry oxygen to the lungs and remove carbon dioxide from the lungs. CPAP also can help open airway during sleep. Intensive spirometry to monitor the patient's lung condition further and can detect other problems that occur in the lung. Monitor blood pressure to ensure blood pressure stability, and patients should measure blood pressure in the morning every day. Number 2 is OT or occupational therapy. OT treat injured, ill or disabled patient through the therapeutic use of everyday activities. Can help this patient develop, recover, improve as well as maintain the skill needed for daily living and working. Among the OT methods that can be performed for patients with pulmonary edema are stay out of air pollution, schedule short rest break, and active cycle of breathing technique. Active cycle of breathing technique done every morning and to control pattern of breath. Stay out of air pollution can affect the condition of the lungs and the heart. Increase respiratory symptoms such as irritation of the airway, cough, or difficulty breathing. Also can cause decreased lung function. Schedule short rest breaks needs to be done throughout life to control mental stress and able to control breathing when life is in order.
Hi, Assalamualaikum. My name is Nur Hazani binti Halim. My metric number is DNS 07212210. I will present about complication of pulmonary edema. Pulmonary edema can cause severely compromised oxygenation of the blood by the lungs. In general, if pulmonary edema continues, the pressure in the pulmonary artery can go up, so-called pulmonary hypertension. Eventually, the heart becomes weak and begins to fail, and pressures in the heart and lungs go up. Complications can include, first, respiratory fatigue. This usually manifests as lethargy, fatigue, diaphoresis, excessive sweating, or worsening anxiety. High-frequency respiratory fatigue occurs rapidly, while low-frequency fatigue may develop slowly over a longer period of time. Second, swelling of the abdomen or lower extremities. The sudden swelling of the legs and ankles or the stomach area may indicate the build-up of excess fluid outside the lungs. Third, cardiac arrhythmia. Generally, this involves problems with the heart rhythm. Your heart may beat too fast, too slowly, or irregularly. Continuous monitoring of the heart rhythm is sometimes necessary. 4. Acute respiratory distress syndrome. A form of respiratory failure, acute respiratory distress syndrome occurs when fluid leaks into the damaged lungs.
The fluid blocks oxygen from getting into the lungs and can make breathing difficult. This is a serious complication that can quickly become life-threatening. 5. Pleural effusion. This is the accumulation of the fluid between the membranes that surround your lungs. 6. Congestion and swelling of the liver. Pulmonary congestion is liquid accumulation in the tissue and air space of the lungs. It leads to impaired gas exchange and may cause respiratory failure. It is due to either failure of the left ventricle of the heart to remove blood adequately from the pulmonary circulation, so-called cardiogenic pulmonary edema, or an injury to the lung tissue or blood vessels of the lungs, so-called non-cardiogenic pulmonary edema. Pulmonary edema, especially acute, can lead to fatal respiratory distress or cardiac arrest due to hypoxia. Immediate treatment is necessary for acute pulmonary edema to prevent it. Lastly, this is our references. Thank you.
Back to me. This is all from our group about the title pulmonary edema. Thank you.